Assalamu alaikum, dear doctors. In this video, I am discussing leukemia clinical station. This is leukemia patient. Look, hair loss occur because of chemotherapy. Though the child is smiling, the childs are not actually, they are ill-looking leukemia patient. Leukemia patient, that is an oncological cases, and general examination what we find is looks cachectic, small fair age in if on chemotherapy. Vitals, maybe there is rapid pulse due to anemia. Pale, no jaundice, no clubbing, no stigmata of reversal failure. Multiple cannulation scars and bruises all over the body we find. Enlarged cervical lymph nodes, however, I want to examine other lymph nodes. Abdominal examination we find abdominal distension, hepatosplenomegaly, there is no ascites. If boy, I would like to complete my examination by examining private for testicular enlargement. Now, investigation for leukemia, we do full blood count. We find normocytic normochromic anemia with low WBC and platelet count by or pancytopenia. Peripheral blood film we find for blood cell, bone marrow biopsy, blood cell more than 30%, lumbar puncture for CNS involvement, ABG and electrolytes for tumor lysis syndrome, which occurs in bulky tumor either before or after starting chemotherapy, and the electrolyte changes occur in tumor lysis syndrome including hyperkalemia, hyperuricemia, hyperphosphatemia and hypocalcemia. And coagulation profile. So 10% of the patient with acute leukemic have DIC, disseminated intravascular coagulations. At the time of diagnosis, this patient may present with hemorrhagic or thrombotic complications. Immunohistochemistry for phenotyping of Philadelphia chromosome. We do genetic testing. PCR, that is diagnosed and monitor the response to treatment. The blood test is repeated every 3 months for at least 2 years after starting the treatment. Then less than often once remission is achieved. Imaging we find abdominal ultrasound, chest X-ray for lymphadenopathy, wide mediastinum. Remember, we find wide mediastinum in chest X-ray. Now, the treatment of leukemia. Blood transfusions, antibiotics, chemotherapy. Induction of remission 4 weeks, vincristine, prednisolone, cyclophosphamide and anthracycline. And consolidation of remission for CNS prophylaxis. Intensification to clear the residual disease, maintenance for 2 years in females and 3 years in males, prednisolone, vincristine, methotrexate and marcaptopurine. Some children will have to do a bone marrow assessment to check for cancerous cells every 3 months for at least 2 years during the maintenance treatment or after having a bone marrow transplant. Radiotherapy, if spread to the nervous system or brain, the body needs to be prepared for a bone marrow transplant. Mainly young children treated with radiotherapy will go on to have restricted physical growth during puberty. A small number of people develop cataracts several years after having radiotherapy. Stem cell and bone marrow transplantation, and the stem cells and bone marrow transplantation is the last treatment option. There are some poor prognostic factors in acute lymphoblastic leukemia, this including age less than 1 year or more than 10 years, male, African ethnicity, tumor cell count before start of the treatment is more than 15 to 10 to the power 9 per liter, Philadelphia chromosome, CNS involvement, hypodiploidy less than 44 chromosomes, persistence of leukemic cells blast in the bone marrow 4 weeks after induction therapy. So this is all about leukemia. Thank you.